So, oh, yeah. Good evening, all. On behalf of the Indian Academy of Pediatrics, it is my honor and privilege to extend our heartfelt gratitude to all who have joined today for this important press conference on very vital in helping us to spread the awareness about the crucial health initiative. Your dedication to sharing accurate and timely information with the public is invaluable, and we are deeply grateful for your and help. Of the IAP, Dr. G. Basaraj, National President 2024, Dr. Vasant Kalatkar, National President 2025, Dr. Upen Kinjwedkar, National President 2023, Dr. Atanu Bhadra, National Treasurer 2024-25, and all the Vice President, Dr. Satish Sharma sir, Dr. Singar Velu sir, Dr. Ajay Srivastav, Dr. Shantanu Dop, and Dr. Atul Kulkarni, and our all the national coordinators. 1 minute, 1 minute. एक हो जाए no? हाँ? So, Dr. Geeta Patil Madam, Dr. Samir Dalwai, Dr. Kishore Bandhu, Dr. Amrish Patil, Dr. Sandraj Sir, and all the expert committee of the this all the cup module and Maha IP OBs branch of members of this Mumbai, Navi Mumbai and the Thane branch and the spokesperson of the IIP की बात community के साथ. So special thanks to the Sipla division of the Jesta division, Mr. Samrangju Banerjee, business head, Arvind Shastri, Yogesh Tripathi, Gunjan Bajpai for your generous support and their collaboration have been instrumental in making this event possible. We look forward to continue our partnership in the future endeavors to enhance child health and well-being. To our organizing committee, your hard work, Dr. Jitendra Gawane, Dr. Paramanand, Dr. Bela Madam, and all the Mumbai team for your meticulous planning. We have trusted smooth execution of this press conference. Your dedication behind the scenes does not go unnoticed. Lastly, but certainly not least, I extend my deepest gratitude to all the attendees here. Your presence and interest in this topic signify the importance. So thank you, one and all. Thank you, everyone, for making this press conference successful. Thank you.
उसी टाइम पे होममेड रेमेडीज लाइक हनी वगैरह से वो जब कहीं से देखो अलग चीज टॉपिक है और अदर इम्पोर्टेंट थिंग्स अभी तो आजकल बच्चों में हो रही है अलग चीज इसमें क्या है फॉर एग्जांपल उसका बेडरूम वगैरह है डस्ट माइट वगैरह होता है तो उसका बारे में बेडरूम वगैरह इमीडिएट ट्राई वगैरह आईपी के बाद कम्युनिटी की सॅलरी ही वही मानते की आईपी के आमचे जे मेंबर आहेत 45 मेंबर त्यांनी सगळ्यांनी मिळून ही मोहीम राबवली आहे जेणेकरून तू त्यांच्या मित्र त्यांनी डिजिटल मीडिया इंस्टाग्राम ऑल दिस मीडिया ही मोहीम ही जी आम्ही जो मेसेज तो जनसामान्यांपर्यंत पोहोचावा ही आमची जसे स्टेक होल्डर्स असतात टीचर्स आहेत नंतर सोशल वर्कर यांच्यापर्यंत आम्ही जमा आणि तो कम्युनिटी तळागाळामध्ये म्हणून आम्ही करतोय की एवढ्याच पण हा आज नुसता एकटा कप हा आजारावर आम्ही बोलतोय कपच आजार राहणार नाही तिथे वेगळे वेगळे जसं आता पुढच्या महिन्यात आम्ही ORS करतो त्यांचं ब्रेस्ट फिडिंग वर कसं काय अडोसलचा सबस्टन्स अब्यूज म्हणजे आता ड्रग अब्यूज काय झाले आणि आतापर्यंत जे कव्हर केलेले प्रकार ॲनिमिया कव्हर केलेला लिव्हर कव्हर केलेला ऑटिझम कव्हर केलेला ओबेसिटी खूप मोठा हा जोपर्यंत आहे तिथं असं म्हणलं की जोपर्यंत आहे ती आहे तोपर्यंत हा प्रोजेक्ट साधारण सिंगल आपण व्हायरल म्हणतोय किंवा निगेटिव्ह अलर्जी जसं मोस्टली अलर्जी आपण कुत्र्यांचे वगैरे जे असतात काँग्रेसला नंतर शेंगदाणा या काही गोष्टींची अलर्जी कलर सर्वात मी म्हणतोय ते आणि डॉक्टरांना गळ घालून एक माझ्या मुलाला अँटीबायोटिक द्यावी गरम पाणी किंवा गुळण्या करणे त्या गोष्टीमध्ये एक नक्की त्या संस्था फार आपल्याला आवश्यक आहे हा मॉडेल पुढे चालू द्यायसाठी आम्हाला इथे यासारख्या संस्था आणि काही सोशल ऑर्गनायझेशन यांच्या सुद्धा आम्ही
Recording in progress.
We have another program going. Please. So both चीजें two very important things. Please notice QR code. We are not only technically researching our social media platforms, but these are the QR codes we will share with general public also. And please share these websites also, the iapindia.org. So these are the places where authentic information of today's program, but also of all the past programs that we have done. So we good that सामान्य जनतेला जी इत्यंभूत माहिती व्यवस्थित सायंटिफिक माहिती पाहिजे ती तुम्हाला इथे प्लीज कृपया जितक्या शकाल ते सांगा. अगदी बरोबर अगदी बरोबर. सो आमचे मेंबर्स ऑलरेडी मला सांगायला अतिशय आनंद होतो. महाराष्ट्र सरकारकडे जोडायचं झालं प्रोग्राम आपले माननीय शालेय शिक्षण मंत्री दीपक केसरकर यांच्या
Thanks.
जिल्हा परिषद शाळांमध्ये
Thanks.
IIT फक्त आम्ही सामान्य शाळांमध्ये सामान्य विद्यार्थ्यांकडे
Thanks. Chalo. Thank you. Thank you to all the members of the press. Thank you very much. We will now proceed with our next event. Are we online now? There is tea and refreshment snacks arranged on the second floor. We request all members of the press to please join us for a cup of tea on the second floor. Are we online now? Yeah. All right. So, good. May I request everybody to settle down, please?
Check. Check. People have joined earlier and left. Yeah, can we all settle down, please? Geeta, madam. All right. So, good afternoon. Namaskar, pranam to all the members of the Indian Academy of Pediatrics. I would like to also welcome our respected national presidents, Dr. Basavaraj sir. I would like to welcome Dr. Vasant Kaladkar, President-elect, Dr. Upendra Kinzavadekar, immediate past President, Dr. Yogesh Parikh, Honorary Secretary General,
Dr. Atanu Badra, National Treasurer, and respects to all our seniors whom I shall be inviting one after the other. Meanwhile, it's my proud privilege and pleasure to welcome all the members of the Indian Academy of Pediatrics to this session of the IAP Ki Baat Community Ke Saath session on tackling cough with care. As you are aware, this is the 7th in the series of IAP Ki Baat Community Ke Saath programs held by none other than our National President, Dr. Basavraj, and I would now request our dynamic president, Dr. Basavraj sir, to please address everyone regarding this new program. Dr. Basavraj sir.
Yeah, thank you very much, Samirji. So this is one of the 8th program under the IAP के बाद community के साथ. Honorable respected President-elect Dr. Vasant Kalatkar, our immediate past President Dr. Upender ji, and our dynamic secretary Dr. Yogesh Parikh, National Treasurer Dr. Atanu Badra ji, and we have a distinguished member here at the launching ceremony. We have a national coordinator Dr. Samir Dalwai ji, Dr. Kishore Baindur, Dr. Shantraj, and Dr. Geeta Patil, Dr. Amresh Patil, and we have a senior vice president Dr. Satish Sharma ji, and Dr. Santanu Dev, Professor Singaru Velu, Atul Kulkarni, Ajay Srivatsav, and our ICP Vice Chancellor, Professor Sitaraman sir, and Joint Secretary Admin, Dr. Paramanand Anandkar, Joint Secretary Liaison, Dr. Ruchira Gupta. This is one of the program which is really made a big difference across the India, where the our parents are looking for an IAP's relevant and reliable information. On this day, we are launching and tackling the cough with care. That's an 8th program, because once the monsoon has set in different part of the country where the cough is becoming a major problem, where we need to know, educate our parents in terms of when the parent should be worried, what are the red flag signs like in a respiratory distress or in a retraction of the chest, change in the level of the consciousness. And these are the things which has been prepared by our scientific team led by none other than Professor Nagbhushan sir, Dr. Pawan Kalyan, and many of the members who has been Dr. Inamdar, and all the members has been involved in that. So this is a need of the hour. I am sure this information is going to be very, very useful. With these few words, the best wishes for this program. Thank you. Thank you very much.
Thank you, Basra sir, for those wonderful words of wisdom. Now we request our President-elect, in his absence, I request Dr. Upender Kinjwadekar sir, our immediate past President, to kindly address.
A very good evening, friends. Respected National President of Indian Academy of Pediatrics for the year 2024, Dr. G.V. Basavraj, President-elect Dr. Vasant Kalatkar is just out, would be joining us soon. Honorable Secretary General of IAP for 24 and 25, Dr. Yogesh Parikh, National Treasurer of Indian Academy of Pediatrics, Dr. Atanu Badra, Senior Vice President, Dr. Satish Sharma sir, Dr. Sitaraman sir, Dr. Santanu Dev, Vice President East Zone, and the 4 pillars of this program whom I am meeting here in person. In fact, 5th one is always here, Samir. But really, let's give a big round of applause to Dr. Geeta Patil, Dr. Shantaraj, Dr. Kishore Baindur, and of course, Dr. Amresh. That's a great honor to all of for having you all in the IAP office. So friends, those who have logged in online, this is a double delight today. Today in the morning, we have inaugurated the 4th floor. Most of you must have visited here before, but this is a totally renovated, wonderful place wherein its own IAP's own house, and we can have all our programs over here. So great to have all 4 of you over here. And what a great timing. We have started off on 13th of February with anemia, and today we are launching cough, and this could not have been better, Dr. Basavraj. We are just, monsoon is beginning at most of the places, and why not discuss about cough? So it was very, very important, because the program and the timing has to be matching with the national need of the hour, and cough is here right now. So great to know, and let's know, friends, pediatrician friends, all of us know we have been deliberating in our conferences about how to tackle, how to differentiate a brassy cough, a dry cough, a wet cough, a pertussis cough, whatnot, asthmatic cough. But I think these messages have to go loud and clear to the masses, and then only we'll be successful. If at their level only filtering happens and patients with a trivial cough and naak bahti or thodi si khasi hai waits there for 2 to 3 hours outside pediatrician. So pediatricians is the only community, you know, हम लोग बोलते हैं कि अपने पैर पे अपने हाथ से कुल्हाड़ी मारते हैं, but we want to do that. We want to give that message कि ये खांसी के लिए आपको आने की जरूरत नहीं. But these are the warning symptoms when you have to come. You have to go to the nearest healthcare setup. And unless and until we do that, we wouldn't be doing justice to our job. And we want to not only have healthy and health and well-being of children, but we want to have preventive healthcare. And that can only be served with this wonderful community outreach. Let's not let this program not remain within the confines of our consulting room. We getting empowered and enriched more. We put a banner somewhere outside the clinic and our job is done. No, not at all. Please spread the word wherever you can. Go to the schools, be a member wherever, if you are in Rotary, Lions, anywhere, IMA. Let's enrich our IMA colleagues because they also look after so many patients. A huge load that goes there also. Why don't we prepare them that how to identify a serious cough, a trivial cough, where the doctor needs to be approached very fast. So I'm sure that all of us can do that. And a big round of applause to Dr. Basavaraj, Dr. Vasant Kalatkar, and the entire scientific team for coming out one after the other. And let's try to, the ultimate maqsad of the program, never forget that it not IAP ki baat, IAPians ke saath, it's IAP ki baat, community ke saath. So let's always remember that time. Thank you so much and best wishes for all future endeavors.
Thank you, Upendra sir. Your zeal for and enthusiasm is unmatched and showing us the way ahead. I thank you once again on behalf of the team. Now I request all the delegates on the dais to do the press release. After that, I'll ask request Dr. Vasant Kalatkar to address. I request all the delegates to kindly do the press release of the cough care. It will be on the digital screen. So I request all the three presidents to kindly declare it to be.
Yeah, we declare the press release.
Thank you, sir. I request all the APNs to kindly take it into the regional languages. Now I request our President-elect, Dr. Vasant Kalatkar, to kindly address.
Respected Dr. Basavaraja, our President, Honorary Secretary Dr. Yogesh, our past President Dr. Upendra, Dr. Atanu, our Treasurer, all the office bearer, Vice President, Media Committee and Scientific Committee, and Karta Dharta of this project, Dr. Geeta Patil, Dr. Bander, Dr. Shashanam, and all the people and my dear friends, IAPN friends. This is always, you know, why we are here and we are having all this 1 hour troubling you, because we want to spread the message whatsoever given by IAP to all the people. Today about cup, lot of things has been told. I think Upendra told that what is the cup and everything. I will go in short. So this is today's topic. We are going the tackling cup with care, aims to raise awareness, promote effective treatment strategies, and encourage preventive measures to combat this passive condition. Although you all know, it seems like a minor inconvenience, a cup can be a symptom of various underlying conditions, and addressing it with care is crucial for our overall health and well-being. Cup can be categorized into acute, subacute, and chronic, depending on their duration. Coughing is a natural reflex that helps clear the airways of irritant and mucus. Yet, it can be also a single more seriously underlying health issues. As we know, cough can be classified into 3 categories. Understanding this distinction is vital in determining the appropriate course of action. A chronic cough lasting more than 8 weeks may indicate more serious conditions such as asthma, chronic bronchitis, or even gastroesophageal reflux, that commonly known as GERD. Treating cough definitely depends on its cause. Viral infection might just need rest, fluids, and OTC remedies, sometimes honey.
But if a cup sticks around or comes with troubling symptoms like shortness of breath, chest pain, or blood, it seems to see a doctor. One should consult doctor. In addition to seeking appropriate medical care, there are several home remedies and lifestyle changes that can help alleviate cup symptoms, including these: hydration, using humidifier to keep the air moist, avoiding irritant like a smoking, strong odors, colors, and elevating the head while sleeping to prevent postnasal drip. These are some remedies. Preventive measures like avoiding allergen and encouraging hand washing, vaccination against respiratory infections, and avoiding exposure to environmental irritant are foundational steps. For individual with chronic cup, effective management and adherence to treatment plans are essential in minimizing cup-related complications. Let us burst some myths too. Antibiotic don't work against virus and should not be used willy-nilly. Though parents are insisting, don't use it. Misusing them can lead to antibiotic resistance. Always go for a prior diagnosis and treatment plan for healthcare provided. In conclusion, while a cup seems like a minor element, it has a potential to impact individual lives significantly, like a school absenteeism, dizziness due to drug, depression, body ache, and fever. By promoting awareness, advocating for appropriate treatment, and encouraging preventive measures, we can make a substantial difference in health and well-being of our communities. Let us work together to tackle cup with care, ensuring that every patient receives the attention and treatment they deserve. I again and again in all my lesson, I tell you that always disseminate whatsoever knowledge you are getting about the IAP के बाद community के साथ subject. Disseminate as it is, and please through your media, your print media or digital media, please disseminate it so that it should reach to community at ground level. Thank you for your commitment to this cause, and I look forward to our continued effort in improving respiratory health. Thank you.
Thank you for that inspiring address, Dr. Vasant Kaladkar. I now request our Honorary Secretary General, Dr. Yogesh Parikh, to please guide us about the work that IAP is doing on the social media. Thank you.
Thank you, Dr. Samirji. So, I welcome our beloved President, Dr. Basavaraj, President-elect Dr. Vasant Kaladkar, President 2023, Dr. Upen Kinjwarkar, and my dear friend, Dr. Atanu Badra, Satish Sharma sir, Singarulu sir, Dr. Shantanu, Dr. Ajay Srivastav, and Dr. Atul Kulkarni, and all the EB members and our media teams. So here we welcome our chief guest. Today's chief guest is our from the Nepal Society of the Pediatrics, Dr. Major General Arun Singh sir, and our senior most renowned pediatrician from the Bangalore, Dr. H. Parmesh sir. This is two important guests today. We are here for this this launching of this program. And I also, in continuation with Dr. Vasant, let us spread the awareness by the social media. We have official channels of the WhatsApp, Facebook, Twitters, and all the social media we are using from the IAP office. So this authentic, reliable, and relative official information to the parents, to the teachers, to the community, let us spread by our efforts of our all 45,000 pediatricians. We can spread this, we can subscribe this official media and then percolate to the community. So I thanks Dr. Basavaraj, Dr. Vasant Kaladkar for creating this great platform for the awareness of the all this common child health issue. And our media committee is working hard. Dr. Geeta Patil Madam, Dr. Shantraj, Dr. Kushir Bandhu sir, Dr. Amrish Patil, and media love person Dr. Samir Dalwai. So today's program is already this support of our Maharashtra office bearers and the Navi Mumbai and the Thane branch, and we have all supported very well. So today's expert committee, Dr. B.S. Sharma sir and Dr. Nagbhushan sir, then Dr. Shilpa Hazare, Dr. Indranil Haldar, and Dr. Pawan Kalyan from Andhra Pradesh. And with the support of Sipla Jesta, we are gathered today here. So thank you very much. All please subscribe this our official platform and percolate this official relevant IIP की बात community के साथ information to the society. Thank you.
Thank you, Professor Yogesh Bhai Parikh. And now I request our National Treasurer, Dr. Atanu Bhadraj, to please address the members on the role of IAPNs and the excellent media outreach and the press media outreach that we are working on, and to share his experience. Thank you. Dr. Atanu.
Thank you, Samir. We had a very busy press conference here when we had hundreds of questions coming, and Dr. Basav sir, Dr. Vasant, and Dr. Upendra handled them well. It only goes on to show, it only shows that there is plenty of interest in the society and in the media for this. I would request all our members to utilize this interest. Let us meet individually to all the contacts in the press, to the parent groups, and to the patients to transfer this data and information, and to talk to them when to prescribe the cough syrup, when to prescribe antibiotic, and when to come to the doctor in terms of cough. That way, we'd be avoiding the use of irrational use of cough syrups. We'd be avoiding the irrational use of antibiotics. And I think IAP के बाद community के साथ would make a successful dent in the society, a successful awareness in the society regarding this cough. And today we had a cough questionnaire also. It would be shown by the scientific team, which would be the most powerful tool that you can handle. You can hand over to your patients and the parents of the patients, so that they can be scientifically deal with cough and when to intervene. And I would request that this is the eighth topic that IAP के बाद community के साथ had been the eighth topic that has been launched today. I would request that please let us continue the work that has been done. Plenty of hard work of plenty of the whole team, the media team, the scientific groups, and of course our office bearers and our national president. So it's time that we utilize this material in our hands, in our chambers, in our hospitals, and in our OPDs. And I think through this program, not only your practice will be enhanced, but the name and prestige of Indian Academy of Pediatrics will definitely go a long way. Thank you.
Thank you, Dr. Atanu. Thank you so much. And I'm also happy to acknowledge the presence of our chief guest, Major General Dr. Arun Kumar from Nepal, as well as our own Dr. H. Parmesh. I'd now like to mention that any work, any program done is incomplete without a measure of accountability. And we hold ourselves accountable to all the members. So Dr. Amresh Patil, my dear friend, will now give us a quick report of the work done over the past 7 topics that IAP के बाद community के साथ has done, especially the previous program. So it's over to Dr. Amresh.
Thank you, Dr. Samir sir. As mentioned, this is our 8th program. The last 7 programs have been a wonderful success. Though anemia was launched in January, there are anemia screening programs which are still going on. So as our National President Prasad has mentioned, these programs have been officially launched but can be carried out throughout the year. So wonderful activities from Kanyakumari to Kashmir, from Shillong to Rajasthan, wonderful activities under the guidance of our senior vice presidents. So I now request a small video. Pictures speaks more than 1,000 words. A small video will showcase the activities done by the various IAP members. So I request the team to kindly play the video. meeting. So if you see those videos, we can see the diversity. As our past president was saying, nourishing with diversity is one of the basic necessity for complementary feeding. We can see the diversity activities which are taking across the India for the welfare of our own children or the future of the country. I request once again each and every IAPN to kindly share, promote, and regionalize these wonderful guidelines, and let us see our Bharat of future successful one. Thank you, IAP.
So very important message for all pediatricians by Dr. Amrish about diversity and how complementary food has to be diverse, how IAP has to be represented with a diverse talent from all over the country. And the experts for this program on cough are convener Dr. S. Nagabhushana sir, Dr. B.S. Sharma ji, Dr. Shilpa Hazare, Dr. Indranil Haldar, and Dr. Pavan Kalyan, as you see, from diverse parts of India. And we are very proud and honored that Dr. Professor S. Nagabhushan sir agreed to help and lead this expert committee on tackling cough with care and what messages should be sent to the people. So I request Dr. Sir, who has joined us online, to please. Can you hear me?
Yeah, I can.
Yes, please go right ahead, sir. It's over to you, Dr. Professor Nagabhushan sir.
Thank you, Dr. Samir, and all the office bearers of Central IAP. At the very outset, I would like to share with you that this activity is a group activity jointly done by all 5 of us. The 2 of us, me and Dr. Sharma, were the senior colleagues. Dr. Pavan, Dr. Shilpa, and Dr. Indranil, each one of them have put in their hard work, time, and effort. So the success of this particular module should go to the group. A cough is a very common problem that not only bothers the child, the parents, but sometimes even the pediatrician, because time and again parents ask us, sir, how long will this cough last? Could we stop it? The success of treating a child with cough depends on how the pediatrician communicates with the parents. If I tell parents on the very first day of a viral illness that cough will last for around 7 to 10 days, parents will be more than convinced. Giving your time to share with parents that cough is only a symptom and not a disease, and this symptom at many times is more protective, trying to bring out phlegm from the child's respiratory system, helps parents to understand the cough. The next question that we should ask ourselves is whether the cough is worrying the child or the parents. More than not, it worries the parents much more than the child. The other issue with parents would be that a child coughs only during the day and night he is comfortable. And this is very classical of a habit cough. Vis-a-vis, there is a child who also coughs at night and also frequently, which could be a sign of either a reflux disease or much more commonly an allergic airways. There are a few red flag signs which every doctor treating a child has to look for. If the cough is associated with feeding difficulties, if the cough continues even after 3 weeks, if the cough is associated with weight loss, if the cough is associated with symptoms in other systems of the body, or here is a child who is not thriving well, or cough in an infant, or cough starting from very early in life. These are a cough that starts all of a sudden without premonitory signs. These are the few red flag signs of cough which need investigation. The common question that most parents ask us are two. Would you want to do some blood tests for our child? would you want to take a chest X-ray? The answer to both in most situations is a big no, because most coughs that children get are due to viral illnesses, and this cough will subside usually by about 2 to 3 weeks, and therefore investigations may not be necessary in each and every child. More so because cough is an airway disease, and therefore X-rays may not show up anything in most children. What is also important is to teach cough etiquette to parents and children, because come June, July, you see a spate of children coming to the clinic with cough because somebody in the family had or somebody in the school had. So it's worthwhile teaching cough etiquette not only to the child but also to parents, to try and prevent droplet infection spread of the virus. The other question that most parents have is whether immunization completely prevents the child having cough. The answer is no, because immunization protects against few illnesses, and there are many viruses and bacteria that are not covered by immunization. However, a completely immunized child is a much better bet than a child who is not. Over-the-counter cough syrups generally do not help, so parents have to seek the doctor's advice in order to take the medicines for the time prescribed. Do home remedies help? Definitely yes. Small things like giving honey in lukewarm water in children above 1 year definitely helps according to scientific knowledge. And there are a few other home remedies which could help the child get better from cough. But the advice and the confidence that a doctor inspires in the child and the parents goes a long way in helping the child and the parents tackle the symptom of cough in the most scientific manner without side effects. The other common question that parents ask us, do antibiotics help? The answer is a major no in most situations. On behalf of the team, we are grateful to the Central IAP and all the office bearers as well as the conveners of this program. Our day will be made if this knowledge percolates to the level of the practicing doctor and the parents, making their lives a much better way to live from tomorrow. Thank you.
Thank you, Professor Nagabhushana sir, and I'm sure your comments are well captured in the press release as well as all the teaching material that has been made, which will be displayed on the social media as well as shared with all our members of the academy. I would now like to invite the scientific committee chair, Dr. Geeta Patil ma'am, to please come over, and she will have the pleasant duty to introduce the chief guest today. So please put your hands together for Dr. Geeta Patil ma'am.
I think good evening everyone. I think we have seen this our IAP ki baat community ke saath. This is the 8th topic, and it has been knowledge has been percolated everywhere through the social media, physical meetings, community programs, and every time we will have a chief guest for this program. But this time we have got a chief guest across the border. So it's a great honor and prestige for me to introduce Dr. Arun Kumar Neopain. He is a retired Major General. And very important thing we should remember, his education he completed from our prestigious AFMC Medical College, Pune, Maharashtra. He is currently the president of the Nepal Pediatric Society for the term 2023-25. He has served 35 years in the Nepali Army Medical Corps, where he was affiliated with the Nepalese Army Institute of Health Science, College of Medicine in Kathmandu. He has served as the head of the Department of Pediatric and subsequently at the principal of the medical college. He has got extensive experience in teaching and mentoring the postgraduates. His special interest is in pediatric epilepsy, research methodology, manuscript writing, hospital administration. Right from beginning of his career, he was an editor. That shows his academic interest. He was editor for the Journal of Sri Birendra Hospital in 2005. And he was editor-in-chief of the Journal of Nepal Pediatric Society, that is a prestigious journal, in 2007. And he has edited more than 40 issues. And he has served on editor boards of many prestigious journals. He has published many papers, attended conferences, CMEs, participated in the workshops and seminars nationally, internationally. He was a faculty in national and international conferences. His vast experience in both the clinical pediatrics as well as administration policy work has helped to create interest in improving and the quality care and services provided by the pediatricians in communities and referral centers in Nepal. That's really a creditable thing. In addition to his clinical service, he has played a very important role in military medical operations for disaster response during the Great Gorkha earthquake of 2015. And because of his work, he was also assigned to lead the medical operations of the National COVID-19 Crisis Management Committee, managing the COVID-19 pandemic at a national level. It's a great achievement for him because of his academic as well as administrative capacities. And as a president of the Nepal Pediatric Society, he has taken the organization to a new level. Our respected president, Dr. Basavaraj, has recently visited Kathmandu. He is a testimony for his work. So he is a member of many prestigious pediatric societies. Now over to Dr. Arun Kumar, and I request him to unveil the poster. Can we?
Thank you, Dr. Geeta Patil, for the elaborate.
Sir, over to address to you, sir. Everybody is waiting for you, sir.
Thank you. Thank you, Dr. Geeta, for the introduction. So I start, esteemed guest of honor, Dr. Paramesh, President of IAP, Dr. Basavaraja, past presidents, President-elect, office bearers, members of the Indian Academy of Pediatrics, and members of the Nepal Pediatric Society, distinguished guests, ladies and gentlemen. Namaskar and good evening. I am Dr. Arun Neupane, President of Nepal Pediatric Society. I am deeply honored and grateful to be in front of you today as the chief guest of this esteemed occasion. On behalf of the Nepal Pediatric Society, I extend my heartfelt appreciation to the IAP for this profound recognition and trust. We are particularly we are thrilled to be part of this groundbreaking initiative, IAP ke baat community ke saath, tackling cough with care. This initiative is a testament to our shared commitment in fostering a robust connection between our societies, its esteemed members, and the broader community. By delivering authentic, comprehensive, and pertinent information on various child health issues through multiple communication channels, we aim to make a significant impact on the well-being of our children. Allow me to introduce our society to you. Nepal Pediatric Society was established in 1981 by a group of renowned and respected doctors with a vision to uplift the health of all children in Nepal. Since its inception, NEPAS has come a long way from a handful of pediatricians to nearly 700 of us spread throughout our small country. We aspire to increase our membership all over Nepal and serve for the health of children here. Our vision, mission, goals, objectives hover around child health, and we aim to achieve it primarily through training and empowerment of our members. In this, our main focus is to have an academically sound, practically skilled, and morally responsible pediatricians. We are thankful to IAP for helping us in achieving our goals. Talking about cough, it's one of the most common reasons for consultation by parents and hospital visits in our setting also. Management of cough requires etiology-based rather than symptom-based approach. It's the duty of the treating doctors to reassure patients about the benign nature of symptoms and refrain from overuse of cough medications. It is advisable that parents be aware of the facts that the adverse health consequences of the medications used to suppress cough is more than the cough itself when it is given for benign reasons. All problems do not come with quick solutions. Making families and community aware on the benign nature of symptoms and the side effects of unnecessary medications is the duty of all pediatricians. Focusing on home remedies is something we can advocate. Having said this, it is also important to identify cough that is associated with growth failures, systemic symptoms, cough associated with wheezing, respiratory distress, and other red flag signs. They need to be looked for, and appropriate management strategies need to be adopted to prevent the short and long-term consequences associated with this. The initiative IAP Ki Baat Community Ke Saath, taken by the present President Dr. Basavaraja and his team, is praiseworthy. After all, the holistic management of children cannot be complete without disseminating knowledge to the community, parents, guardians, and caretakers. These channels, which may include social media, print and telemedia, radio, and more, with regular monthly or bi-monthly updates, it represents a comprehensive and innovative approach to community engagement. We view this initiative as a collective responsibility to disseminate crucial information on child health and other significant healthcare matters to millions of our fellow citizens in this region. At the Nepal Pediatric Society, we are committed to actively participate and engage in this noble endeavor. We believe that through our combined efforts, we can make a substantial difference in the lives of children and their families. Your initiative not only inspires us, but also strengthens the bond between our two organizations, fostering greater collaboration and shared knowledge. Lastly, thank you once again for this wonderful opportunity and for your warm invitation. I am sincerely appreciative of the recognition and trust bestowed upon me. This opportunity to connect with such a distinguished community and contribute to the important dialogue on child health is truly a privilege. I look forward to engaging with you all, sharing insights, and working together to further our collective goals. Together, let us work towards a healthier future for all children. Thank you again for this wonderful opportunity and for your warm invitation. Namaskar.
Thank you, Dr. Arun Kumar sir, for your excellent appreciating words for IAP and our IAP Ki Baat community ke saath reaching in Nepal. And we are looking forward for furthermore programs reaching Nepal. Thank you very much. Over to Dr. Samir for the further proceeding.
Thank you so much, Dr. Arun sir, and it's been a privilege to have you here with us. Any program which is drawn out over a period of not just weeks and months, but over years, is very important that we have a very good monitoring committee and a monitoring mechanism in place. And who better than to do this than the ever efficient Dr. Kishore Bendur sir. So I'm going to request him to come over and as well as introduce our guest of honor, Dr. H. Parmesh sir. So it's over to Dr. Kishore Bendur.
Thank you, Dr. Samir. Dignitaries on the dais, off the dais, delegates who have joined virtually on the platform. It's a proud privilege today as part of the monitoring committee and the core committee of the IAP Ki Baat Community Ke Saath to introduce a doyen of pediatrics. It's none other than Dr. H. Parmesh, the leading pulmonologist and the environmentalist that he is. And it's a proud privilege basically because I also hail from the city that he is, and that is Bangalore. So we travel from Nepal to Bangalore to introduce a person of eminence, and that is Dr. H. Parmesh. To introduce Dr. Parmesh to this august audience is like carrying coal to Newcastle. Everybody knows of Dr. H. Parmesh, born of a farmer family in a small town of Shimoga. He's traversed through across the seas to the US. He was in the United States of America for pretty long, but the call of his country brought him back to India, and he's been serving the children of this country for long. Dr. Parmesh is a pediatrician par excellence, and I can vouch for that, being in close contact with him. He is a pulmonologist of eminence and an environmentalist at heart. He now holds the post of the professor at the Diveta Center for Climate Change at the prestigious Indian Institute of Science. The IAP has honored him with many honors. One among them is being the fellowship of the Indian Academy of Pediatrics. He is a Lifetime Achievement Award winner and also the Shantilal Seth Oration Awardee. A very honorable thing from the IAP to him. The local branch of the IAP, that is the Bangalore IAP from where he hails, has bestowed upon him the Shishu Vaidya Ratna Award too. To name, his CV runs in pages, but I'm taking a few aspects of this. He, mind you, is the founder, member, and also chairperson of about 3 to 4 sub-chapters of the Indian Academy of Pediatrics. Not many have this honor. He is the founder chairman of the respiratory chapter of the Indian Academy of Pediatrics, both at the national and the state level. Under his chairmanship, he was given the Best Chapter Award. He was the founder and chairperson of the IAP Environmental Group and also of the Allergy and Immunology chapters. He also brought into fore the IMA of Bangalore East chapter. Presently, he is a visiting professor at various universities across the globe, from United States to Canada, SAARC nations, Australia, Italy, and many universities in India. To all of you who are not very knowing him about his work that he does in Bangalore, he is a permanent chairman of the Lakeside Trust, of which he started decades ago. He runs a CME every last Sunday of July, and probably it's going on into the 35th year with not much of, involvement of the companies and all. On his own, he has kept this flag flying by organizing a one-day CME to disseminate knowledge. That is his passion for teaching others and disseminating. Currently, the advisor to WHO, UNICEF, COMAD, and Alliance for Global Health. I can go on and on the paeans of Dr. H. Parmesh. I would stop now and ask the man himself, who is on screen there, to address us, sir, on this very important topic of cough in children, and a few words on the community participation of this program that IAP has so vehemently taken upon itself under the leadership of such stalwarts like Dr. Basuraj Kalatkar and Dr. Kinjwadekar. May I request you, sir, to also release the video of this, what is this video? Tackling cough with care. Over to you, sir, Dr. Parmesh.
Dr. Kishore Baidoo, thank you very much for kind introduction. And
sir, when you say release, the video will be released, sir.
Please release.
Officially, you can. Yes, thank you, sir.
Okay. Okay.
How and why do we cough? It's an old form of yoga, dude. No. Before explaining the how part, let's first understand why we cough. Coughing is body's protective mechanism which helps us clear our breathing passage of dust, microbes, irritants, etc. There are 2 types of cough, wet and dry. They may be caused due to common cold, flu, allergies, smoking, etc. Now, let us see how we cough. When anything irritates our breathing passage, our brain activates the cough response. First of all, we gasp in a large volume of air into our lungs. Next, the epiglottis closes off the windpipe. Then, the rib and abdominal muscles contract, putting pressure on the lungs. But as the windpipe is closed, the air can't move out, so pressure builds up. Finally, the epiglottis opens and air forcefully rushes out, carrying the irritant and thus producing a cough.
So, here we go, friends. Next time you find yourself on a coughing spree, instead of getting mad about it, just thank your coughing reflex for protecting you from harmful particles. But remember, my friends, most lingering coughs are normal and harmless. But if you can't figure out the causes on your own, or if your cough isn't getting better after a week or so, do talk to your parents or guardians about it and visit your doctor ASAP.
How and why?
Thank you, sir. You're on the mic, sir.
Okay. Can I start with my slides? Can I start?
Just a second, sir. Just a second.
Okay. I think I have a great honor to participate in this program. So, आपके बाद community के साथ, where we are tackling the cough with care. I think I still remember in 1977, November 1st, I reached India from after staying 11 years in USA. And during 1970, I started practicing. I made a module, a booklet for the common diseases, when the parents should worry, when not to worry, when to investigate, and all these things we presented it. Oh, let it, my slide, okay. Now, I think 2 decades later, Dr. Lokeshwar, he started propagating this on common diseases to all the pediatricians. Now, this time it's way ahead. Community ke saath, we reach everybody. This wonderful Aapke Baat community ke saath is a wonderful idea. I think we're thankful our President Basuraj and his team taking it to the periphery and educating everybody when to worry, when not to worry. Now, I like to sensitize the issue, what already been spoken, how we can tackle the cough. Next slide, please. Next slide. Okay. Now, cough is all everybody knows is a protective reflex. Remove the stagnant phlegm and all this thing. Normally, people can cough. Normally, you can cough up to 10 to 15 times a dry cough, maximum up to 34 times. It is normal. I don't think you should worry at all. Only if somebody investigates anything like where most of them dry cough, it is non-specific cough, it lack any clinical pointers, you don't have to worry. Only wet cough, it is a specific cough, which I got red flag signs, and abnormal chest X-ray if you have taken, those things only needed, so only comes for about 8%. Next slide, please. Okay, when do we call chronic cough? I think in 1970s, when the first textbook of pediatric pulmonology came from William Waring, anything more than 3 months, they called it as a chronic cough. Now it has come down to 2 weeks. Now IAP has taken as a 2 weeks, ADEX and ERCTM, allergic chapter of IAP, and tuberculosis. They take anything more than 2 weeks, you should take a chronic cough. But adult, they go for British Thoracic Society 8 weeks. I am also one of the member of this 2019. All the adult, they preferred 8 weeks. That's okay. We keep it at 2 weeks as the accepted norm for our pediatrics. Next slide, please. Next slide, please. Okay, when you have a viral infection, 2-3 days later, the cough starts. The cough starts and the innocuous stimulus can make you to cough because cough reflex becomes sensitive. It goes up to 10 days. After 10 days, it starts coming down. The sensitivity lasts for 3 weeks. When it reaches the back, the only noxious stimulus can put. So up to 21 days, it will be there. But after 10 days, it comes down. Anything more than that one, you should worry about. Next slide, please. Next slide. Okay. When do you worry? Pattern of presence. So that recurrent cough, every child should have 78 cold in a year. Usually start second week of June, it goes up to November. In Bangalore, we have 78 cold in children. A child who gets a cough and within 2 weeks it comes down, but within a month it starts again. That is a recurrent cough. We have to watch for those children. Second one, a cough after the 2-3 days after cold, cough start, but it takes longer time, up to 21 days to come down. That also wait and watch. It's acute with delayed recovery. But only cough goes continuously progressing here and there. There's a persistent, non-recurrent, remittent cough. Those children has to be evaluated. That comes only 8%. 92%, you don't need any investigation. Next slide, please. Next slide, please. I think what is the prevalence of cough? In 1999, about 350 patients referred to me as a chronic cough. It was only 8%. In 17 years, gone up to 20.78%. In 2017, 21.25%. Only every year in Bangalore, 0.5% increase in the chronic cough is there. Next slide, please. And also, it has got a significant socio-economic burden, social burden with the children. We already discussed about parents will be there. And cough medication, what we spent, we have done in 2017, 83,154 million rupees being spent on the-counter cough medication. I think some of the Australian studies have shown nearly 35% of the parents have seen 5 to 10 doctors. And 6.8% has more than 20 consultants. These are all the parents are worried about it. We have to educate them in this context. Next slide, please. Next slide. Okay, points of in history. When you evaluating the history, watch for nature of the cough. Is a wet cough or a dry cough? Timing of the cough, onset and progression, family history, social history, environmental history, response to previous medication, where it tickles before the cough, we have to evaluate it. Next slide, please. Next slide, please. So I think tessiphonogram is an important method if you need it. When you cough, first sound, first vibration comes here. That is opening of the glottis, out of vibration. Second is closing of the glottis. In between, various vibration comes, you can see where the location of the cough. And the second vibration is absent in few conditions, like laryngectomy, cardectomy, laryngeal paralysis, and psychogenic cough. Now what we call 2018 onward somatic cough. It is absent significantly. Next slide, please. What are the red flag signs? These are all this. You have already heard about it. I want to reiterate again. Onset of cough, neonatal period is very abnormal. Sudden onset of cough, dry cough which disturbs the sleeps, daily moist or productive cough, feeding difficulties, choking and drooling, failure to thrive, history of recurrent pneumonia. These are all the things we should worry about it. And children who have got chest pain, chronic exertion dyspnea, hemoptysis, persistent voice change in the voice, digital clubbing. Digital clubbing starts only in the feet first, then in the hand. When the cystic fibrosis, I have my importance, I have done it. It takes about 3 weeks when the cough starts, clubbing to start. First, the softness will be coming there. Any auscultatory finding in the chest, abnormal chest X-ray in the hypoxia in the room air less than 92%. These are all the red flag signs. Next slide, please. I think there are 6 or 7 variety. You have to listen to the cough to make whether it is abnormal or not. If the children is not coughing, extend their neck, just press on the trachea, they will cough, passive cough. By hearing that sound, you can do that. I'll mimic these sounds. Hackling trachea cough is only pharyngeal cough. It comes like that. This is the pharyngeal cough. Barking cough comes from the laryngeal level. That is a laryngeal type of cough. Brassy cough, we call is a tracheal thing, like this is the type of cough. And bronchial cough comes like that. Then it comes the honker's cough, the psychogenic cough. That's this is how they cough. This is staccato type of cough for mycoplasma, chlamydia. They cough like that. This is what it is. Paroxysmal, it's a wet type of cough. Various foreign body, cystic fibrosis, asthma, they cough like These are all you have to listen to the cough to identify when to worry, when not to worry. Most of our study shows 97% of the cough used to be lower respiratory tract earlier. Now is upper respiratory tract. Allergic rhinoconjunctivitis is the most common cause because pollution of the 10 micron is very. In Bangalore, we have the clean air and good air and satisfactory air, but 10 micron particulate matter is always higher. So that is deposit in the nose and throat, irritating that one. Next place. This is the last cough. A healthy breath will always bring health. Let each one teach one, plant one, and maintain it. You go home with 4 things. Positive thinking, what you learn from today. Protect the Mother Earth and safeguard the Mother's Earth. And also pursue the research, sustenance of life. Think locally, act locally, propagate globally. Propagate the national Vasudhaiva Kutumbakam. Thank you very much for your time. And I'm thankful for the organizers, especially Basuraj and Geeta Patil and group, and having extended invitation for me to spend few minutes with you and learn a lot about that one. I'm with humility, with great honor. I'll thank you again with namaste for everybody.
Thank you, Professor Dr. Parmesh sir, for your wonderful exposition on cough. I now invite Dr. Sitaraman sir, the Vice Chancellor, Indian College of Pediatrics. We have prepared a cough assessment questionnaire, and Dr. Sitaraman sir is going to tell us about it. Over to Professor Sitaraman.
Good evening, all of you. I thank IAP to give me the honor of releasing this questionnaire, which is very important for us to communicate with the community. There are around 5 questions, very simple in nature. But if you are able to convey it to the parents, these 5 questions, and educate them, and to ensure that they do not abuse the cough syrups, and also to note that this 5 questions is going to simplify the living and remove the anxiety in their lives. And these would be widely distributed to you all. And ones are: how frequent was your child's cough last night? How severe was your child's cough last night again? How bothersome was last night's cough to your child? How much did last night's cough affect your child's ability to sleep? Very important. The sleep disturbance is one of the characteristic features of very serious coughs. How much did last night's cough affect your ability to sleep? And this is very important for you to realize that if these cough questions are made very commonly encountered by the parents, they will be able to relax and attend to cough in a less anxious manner. Thank you.
We'd like to specially mention the role of Cipla Zest in the formulating these questionnaire. I'd also like to request our Senior Vice President, sir, Dr. Satish Sharma, sir, to briefly speak to the audience.
On behalf of Indian Academy of Pediatrics, whole our team led by our President, Dr. Baswaraja, and all OBs. I think we have been discussing since morning about the cough, what are red flag sign, and media is a link between us and the community and the society. The one thing the parents ask question is about the diet. Sir, what to give? Don't give buttermilk during cough. Don't give milk. Don't give curd. Don't give banana. So we have to also include this thing in our pamphlets and all these things. The myths about this role of the diet. And as we have been doing in other similar, IAP के बाद community के साथ. So this is very important. Cough is very important for the parents. So we have to take this, our mission forward to all the parents and to the community. I wish good luck for all of us. Thank you very much.
Since we are running short of time, I'd request our other dignitaries, the vice presidents, Dr. Singaravelu, sir, Dr. Atul Kulkarni, and Dr. Shantanu, just come up quickly and declare their support for this campaign. Thank you, Dr. Shantanu.
So thank you on behalf of all vice presidents. I'm very happy to be here that our IAP ke Path Community ke Saath committee under the leadership of Dr. Basavaraj and Vasant Kalekar and the whole team is doing extremely well, where this is the 8th episode reaching to the community very well under one voice and one nation and all 45,000 IAPNs going to the community. Thank you for giving me this opportunity. Thank you. Thank you.
Best wishes.
Thank you for that quick address. You probably saved 3 tickets. So over to Dr. Shantaraj, sir, from the scientific committee for the vote of thanks.
Thank you, Dr. Samir. I would like to take this opportunity to express my heartfelt gratitude to each and every person for making this academic program reaching the common man. So I thank for your active participation, insightful presentation, and engaging discussions, and you have made the event truly enriching. It's my duty to thank our wonderful president, whose kid is 6 months old now, IAP ke baad community ke saath. It was his dream, and we are fulfilling it. Dr. Basuraja, our national president, 24, Dr. Vasant Kalatkar, 25, and Dr. Upendra, 23, Yogesh Parikh, sir, our HSG, and Dr. Atanu Badra, Dr. Paramanand, Dr. Ruchira, joint secretaries. And I thank our chief guest, Major General Dr. Arun Kumar, sir, for his wonderful words. Guest of honor, Dr. Paramesh, Dr. Sanjay Kumar Singh, and our Sitaram, Dr. VC for ICP, and Vice Presidents, Dr. Satish Sharma, Ajay Srivastav, Atul Kulkarni, Singarvelu, and Shantanu Deb. And I thank national coordinators, Dr. Geeta Patil, Dr. Samir Dalwai, Dr. Kishore Baindu, myself, and Dr. Amrish Patel. Scientific committee led by Dr. Priyali Bhattacharya, Dr. Prashant Karia, Dr. Gayatri, Dr. Cherukuri Nirmala, Dr. Manmeet Kaur Sodhi, and Musabir. And media committee headed by Dr. Hamid Dalwai, Dina Shivasav, Sambhavi Seth, Zafar Meenai, and Kanju Walijit. And experts committee led by convener Dr. Nagabhushan, Dr. Sharma, Dr. Shilpa, Dr. Indranil, Dr. Pavan Kalyan. And we also thank Cipla Zest for their encouragement in cough assessment questionnaire. Maha, IAP, EB and OB members, IAP spokespersons, Dr. Shruti and Prajwal from Abhinav Events, the staff of IAP office, and each and everyone who is directly or indirectly connected with this program. Thank you very much.
So as I bid farewell to everybody, I'm happy. Before that, I'd like to welcome our executive member, Dr. Jitu, who has also joined us. Welcome again. And I'm happy that this program on cough, by the grace of the Almighty and everybody's efforts, this program on cough went off without any hiccup. So thank you so much. And we hope this goes across the country similarly. Wish you all the best. And let's make sure that if children do cough, they don't cough for long, and definitely don't get irrational antibiotics for the same. Thank you to President Sir, President-elect Sir, Past President Sir, the HSG Sir, and the Treasurer, and all the respected Vice Presidents, all the members of the Indian Academy of Pediatrics, office bearers. Thank you so much for your wonderful participation. Thank you.
Thank you.
Thanks a lot.